I'm going to be talking about the evolving context of services because while we've heard about the possibility of positive outcomes following trauma and traumatic experiences, none of that detracts from the need to prevent traumatic birth and to respond appropriately where there are disclosures. And of course, Sue started the session with talking about some of the context, and of course recognizing aspects like, you know, real challenges around workforce in midwifery, and what does that mean for the ability to be a kind of trauma-informed system. So I'm just going to briefly talk about two main areas. So firstly, we're going to talk about a good practice guide. If you could move the slide on, please. So the NHS England and NHS Improvement commissioned a few different good practice guides in relation to perinatal mental health that are all available on the NHS website. And one of these is about the real kind of commitment about making maternity and mental health services that care for people in the perinatal period, making all of these services trauma informed. So this guide that was developed by Claire Law and colleagues really had an emphasis on people with expertise through experience, including parents with lived experience, and also staff, because of course recognizing too that in our workforce people have lived experiences of trauma. So what do we mean by trauma-informed care? Really, it's about feelings of psychological safety, choice and control, and how we can promote these. So the idea with this good practice guide in becoming trauma-informed is about improving experiences of care, reducing harm and protecting staff. So, you know, prevention in the first place, but also being aware of the different ways in which trauma might present, how it might manifest, how we might recognise that, and how do we respond to trauma, and also thinking about impact for staff as well. So there are four principles which are outlined in the guide about how to become trauma informed. And there are various case studies and practice tips from different areas of practice. And I think I just wanted to highlight that, as well as talking about the importance of trauma informed care, it talks about the need for trauma informed systems. So this isn't just about individual practitioner responses. How are our systems trauma informed? You know, how do different parts of services work together, for example, to mean that someone doesn't have to keep sharing the same information repeatedly? What are those really practical things that can happen, and what needs to happen in systems in order to be trauma informed? And of course, there's implications around staff training and supervision and peer support, and probably several people on the call will be involved in pre-registration education of our future midwives, and of course recognising that this applies really early on as well, thinking about our trauma informed care. So the other area that I wanted to talk about was recognition about the huge changes that are happening around maternal mental health services. So as part of the NHS long-term plan, there was this ambition to bring in these services that would help to address some of the gaps. So we've had this enormous investment in specialist perinatal mental health services, but people were still falling into gaps, particularly around childbirth-related trauma, perinatal loss, so pregnancy loss, baby loss through removal of a baby into social care, and also severe fear of childbirth. So the idea is that within areas, within different regions, people would work together to map what the services were locally and see what these gaps are to bring in solutions to this, and also avoid unnecessary repetition. So these maternal mental health services involve joint working between maternity and mental health, but something I wanted to flag is that the models differ enormously in different areas around the focus of the service, and whether it's a single focus. Is it particularly, for example, around birth trauma? Is it trying to cover all the areas that I mentioned previously? Who is providing the services, and what support's offered? So there are lots of different types of psychological interventions that could be offered. They could really differ in length, and they've got different resources available. So there's also different funding available for these different maternal mental health services. And there is a real range of services and practitioners practitioners. So some of these are actually being seen as an expansion of specialist perinatal mental health services. Others are locating them in maternity and bringing psychology into maternity. Some involve charities, for example, involved with pregnancy loss and baby loss. So there's real differences here that are really important sites of inquiry for us to understand more. They also vary in the extent to which their role is around training, maternity and other services in becoming trauma informed as well. So the idea being not only are we responding to the trauma that we see, but ultimately there should be less trauma because we're trying to become more trauma informed. So potentially you might need initial quite a lot of investment, and then we see less need perhaps going forward. So this was really just to flag how much change is happening at the moment. So nationally, this is an area of huge growth. The idea being that in 2023, services are up and running. They've got all these different models so we can find out more. It's an opportunity for learning. And there'll be more specialist mental health and maternal mental health services, midwives roles that people might be interested in, and to link with the NHS Futures collaboration platform if you want to find out more.